I walk these communities in East Central St. Catherine day and night. Each day, each street, each PD, each house, each person, because all are independently important to the transformation to which I invite your partnership. That's the reason I'm running to become Member of Parliament for East Central St. Catherine. And one of the things I've discovered, a lot of multi-generational families are in this constituency. Let me break that down. Grandmother, mother, daughter, brothers and sisters. And that is the standard, and that is how it's supposed to be. But you see, since Corona and COVID-19 and the impact it has had in Portmore and in East Central St. Catherine, anybody that don't realize that health and healthcare are the most important things that a representative can do for a constituency, don't ready for this kind of work yet. Let me tell you what I will do within the first 24 months of becoming Member of Parliament. There are presently no public health clinics in the constituency, except for one which is in Gregory Park, temporarily housed in property owned by the Catholic Church. I want to big up the Catholic Church for always being a partner of community spirit and community development. But the truth be told, we have greater need for a larger facility that can provide more services. Communities like Cedar Grove, Hamilton Gardens, Portmore Pines, Silverstone, Christian Gardens, and I could go on to mention Watson Grove, Southborough, and many others that make up East Central St. Catherine, need a modern 21st century state-of-the-art and the science facility where public health can be readily available, easily accessible, and not as expensive as what they have to do by driving to Kingston, to KPH or UWI, or to Spanish Town, or paying for private health care. I've also come across a lot of diabetics, people with sugar, a lot of hypertensive, people with pressure, people recovering from cancer treatment, people recovering from COVID, people who are unable, because of the loss of income, to afford the kind of health care they used to be able to pay for. That should not be. That will not be. Within the first 24 months, I give you my word. Just as I did in Northeast St. Elizabeth, I will create a transformed health center right here to become the greatest gem in the public health sector that gives primary health care close to communities, to the people that need it. And let me tell you this, it will also be a launching pad where you can have community nursing aides who are there to go out and give the medication and give the guidance to the persons within their homes as to how they should properly take their medication. Check to see if the wounds are healing, if the bandages are being changed, if the nutrition that should be going along with the medication is actually happening. Mobile clinics that can drive to your gate and a professional comes in and take the sugar test, take the blood test, or take the samples and bring them to the lab to be tested. That's what a community, a constituency like East Central St. Catherine deserves. A modern times now, and the modern times must reach you, and it must reach you first and foremost in healthcare delivery. Raymond Price is big on health. Vote for me and I will ensure that that transformation not only begins but is completed within 24 months. Check my record. That's what I did with the Santa Cruz Center of Excellence, and that's what I will do with a brand new health facility right here in this constituency. If you love your mother, if you love your father, if you love your children, if you love yourself, a Raymond Price going to do that for you. On election day, vote for Raymond Price. Vote for the People's National Party. Better yet, vote to power your own future. And I am the MP to give you the turbocharge. Respect and honor.